in today's COVID-19, we see that like in Trump's discourse saying that, this is a Chinese virus. Even in Turkey, nationalists say that too. Even the current Turkish government says that, the COVID-19 came from the West, although there were many people who came from Umrah, from Saudi Arabia, and also there were many Iranian tourists. So the West and China is blamed. So there are basically two reasons why there is that kind of stigmatization. Especially one of them is pertaining to this COVID-19 situation, is that the political scientists and economists show that actually China is becoming more and more politically and economically powerful global actor and rivaling European countries and the US. So villainizing and stigmatizing China is a political strategy. And the second factor behind stigmatization is related with the fact that there are many unknowns about the new diseases. These unknowns are kind of replaced with the false knowledge, like conspiracy theories, like China produced this virus. Like all these stigmatization and conspiracy theories are psychologically calming down a certain group of people who believe in these stigmatizations and conspiracy theories. Like gives a kind of false sense of calmness or false belief in the sense. So villainizing and stigmatizing has that kind of temporary psychological function, we can say. There are certain problems, but there are also certain positive aspects in terms of health implementations of Turkish government against COVID-19. But the most important problem was, still is actually, is the lack of transparency. We still lack some detailed data about testing, and all this lack of transparency actually leads to the lack of trust against the government. And it's not even lay people, but many medical authorities say that actually we have many more cases of COVID-19 patients. And the other problem was, of course, the Turkish healthcare system was not ready for such a big crisis, and it was obvious, especially many healthcare workers, doctors and nurses to begin with, especially when they deal with patients, they weren't distributed the masks. They created wonders, with few little materials. They could be able to improvise really well and to really care of the COVID-19 patients. Another problem related with health policies was related with the fact that the city hospitals, şehir hastaneleri in Turkish, which is a big project of current government, proved largely unsuccessful in this a pandemic, because they are so far away from the main city centers. And the old public health approach of educating different people from different socioeconomic and demographic backgrounds and saying that what is COVID-19? Why do you have to wear masks? Why do you have to quarantine yourself? Was partly successful due to the public health tradition. In terms of consumption habits, we can talk about two different trends. Some people think more of long-term consequences of their everyday life behaviors, of not polluting, or upcycling or recycling, whereas some people just celebrate the nature's recovery, but they don't partake in that. As in medical anthropology, we always state that actually health is a cumulative matter. Like the previous health conditions, previous illnesses we have as human beings affect actually how our bodies react to new diseases. If we interpret this health as a cumulative notion for the disadvantaged groups, we can say that the disadvantaged groups have already important chronic and infectious healthcare problems or health problems like illnesses and disabilities. So that is why we see that actually COVID-19 affects them more crucially. We can give the example of Syrian refugees who cannot, Syrian refugees in Turkey who cannot even be granted the title of refugee. This kind of legal problem make them uncertain about how they would benefit from healthcare services in Turkey. They are actually granted free primary healthcare services. Many of them think that they would pay money, and many of them, more importantly, they don't trust the state hospitals because they believe that there are police there. Even before this pandemic, in my research, I realized that the Syrian refugees I worked with had serious health conditions. So even though we don't have numbers because of the lack of transparency in the Turkish government about how many Syrians or refugees have COVID-19 or died of COVID-19, I assume that they suffer more from the disease because of their previous healthcare conditions. We can count on many political prisoners, and they're mostly elderly philanthropists such as Osman Kavala, or elderly politicians such as Gültan Kışanak, or journalists such as Ahmet Altan. So many of the family members of these inmates are worried, are concerned about their, about the people's health as well as the society, of course.